Hey, what's up, walk-ins? Welcome, fam. Nick and Michael back with you for another episode. And as we always want to help you grow your clinic, sometimes we have to have uncomfortable conversations on a podcast, which we will try to make as comfortable as possible today, because we're going to be talking about the One Big Beautiful Bill Act.
Yes.
Yeah, that should be fun, but it's important.
Yeah. So where are we? We are late July right now. So July 24th, 2025. I'm putting that out there because, boy, things can change quickly. So please don't ding us if you're listening to us in like 3 months from now. It's like, well, what are you talking about? Because things change.
Right.
But, yeah, so the big, beautiful bill passed.
July 4th.
July, yeah.
America.
Was that timed? Who knows? You know, it's just.
I'm positive.
Like, it's just
positive.
It's comical sometimes.
That it was signed for that.
But anyway, there's a lot of big things in that big, beautiful bill, more than what we're talking about today. But the big item that has urgent cares talking, and when we say that is we've talked to multiple urgent cares that are clients and are not clients, and they brought that up as, hey, Medicaid's changing. And
it wasn't delivered quite that nicely, but yes.
Yeah, so Medicaid is changing from a provider standpoint, they don't like the way it's changing, from what we've heard. But
so far, that's what we've heard.
And so the goal of today's episode is to discuss it. Nothing political here, other than simply there was a bill voted in, and then this is what the bill is saying. And we'll go through that because, like most, you can't trust what the news tells you. Nothing political here. Just simply every single person that tells you something has a bias in what they're telling you. Period.
And a paycheck attached to it.
Right. Period. Like I don't care on which side of the aisle you're on. If I am paid $100,000 a year to report news, I'm going to do whatever my boss says to a certain degree. And that's just the nature of it. So if I can encourage anybody here, if you're very curious about this bill, go to the government website that lists the actual bill with all the information and just read it. Or have chat as we're doing here. Have some AI assistance.
Yeah, so I did a multitude of things to research for this. I didn't spend an enormous amount of time, but what I did is I said, okay, I went to the site. That's what we had read. That's where I wanted the information pulled from. And then I want to understand it a little better because even that website that puts the information out there is still from the president. So it's going to come with its own perspective.
Everything's got, everybody has their own angle of everything.
So here's what I did. I took it and I said, I want a critical perspective and a supportive perspective. So I can give you both perspectives that exist. Mm-hmm. And then what we're going to do is we're going to show you how to break through that for your urgent care to be profitable when there is uncertainty. And even from most urgent care's standpoint, not looking good on this bill. So
yeah. And also that reminder too, what we're telling you now is to help prepare for what's coming. Like most bills, they don't magically just start happening. Like there's a time for all this stuff.
Right.
And if I'm not mistaken, you can correct me, I think majority of these changes, the overall effect is like a 10-year window, if I'm not mistaken.
Yes, it's in here. I think there's a certain 2034, I think, is when most of it is going to unfold. Yeah. But I would much rather you be
ready.
Yeah. Let's get you ready for the next 2 to 3 years.
Yeah, exactly.
So this is going to sound like me reading, and I'm going to tell you why.
Because
I'm reading. Here's what I'm very, very careful to do. I don't want my bias in here at all.
No.
I don't want your bias in here at all. We're not here to debate politics. We're here to give you what we found and information. You can have your own opinion. I have my own as well.
And at the end of the day, if what we tell you today, like, I don't think that's correct, great.
Let us know.
Let us know. 1, 2, go do your own research.
Right.
And this is a fun fact. Research is not looking at news sites.
No, it's not.
Because that's not all of the research. There's because like we just said, like there's an opinion inside of any news article, period.
All right.
So, all right, here we go.
Strap in, buckle up. We're going to help you get more patients, deliver better care, get repeat visits and scale. Part of that's attacking some of the things that are going on that you have no control over. So let's start with the critical perspective. This is considered a threat to access and equity. Opponents argue that OB-BBA, that's a lot of B's in there, but that's what it is. The One Big Beautiful Bill Act. OBBBA.
ABBA.
It imposes significant barriers to healthcare access, particularly for low-income Americans, rural populations, and immigrants. Key concerns include, Michael, Massive Medicaid cuts, nearly $1 trillion in reductions over 10 years, which could leave 10 to 12 million Americans uninsured. Work requirements. They're going to require people to that are enrolled between the age of 19 and 64. They have to either work or they have to volunteer 80 hours a month to remain eligible. And a policy critics say disproportionately affect those with unstable work or caregiving responsibilities. They have shortened the ACA support, enhancing premium subsidies that expire in 2025. Likely leading to higher cost for 20 million plus Americans. Administrative burdens, more frequent eligibility checks, and new cost-sharing rules may cause vulnerable people to lose coverage due to paperwork lapses rather than ineligibility. And finally, rural healthcare strain. Despite a $50 billion rural hospital fund, many warn it's not enough to offset closures and staff shortages exacerbated by reduced Medicaid revenue. This law risks undoing decades. This is a quote. This law risks undoing decades of progress in healthcare access, particularly for the most at-risk communities. That's for the healthcare advocacy groups. That is the, I don't like this at all. And that's that.
So that's the view of this will cause harm.
Yep.
Is the mindset, which makes sense.
I'm not
on the front end.
Yeah. I'm not going to debate that. I think there is a case that things are going to be going through a painful period.
Yeah, no, change is painful, and I think in all big bills like this, there are winners and losers in each side.
In each one, every time.
There's no winners. Actually, in the world of this country, there are no winners only. There are definitely losers that happen.
Yeah, there are. It just depends on which team loses that day.
Yep.
Right.
So that's the this is not a good idea, Bill.
Yep. And for those who are supportive, I want to give you that perspective as well. So the supportive perspective is a push towards sustainability and responsibility. Supporters frame the OBBBA as a necessary course correction aimed to encourage independence, controlling cost, and empowering local innovation. They highlight personal accountability. Work requirements promote self-reliance and community participation while preserving benefits for the most vulnerable. Fiscal sustainability. The cuts to Medicaid and the ACA subsidies are framed as essential to curbing long-term federal healthcare spending and reducing deficit growth. State flexibility. So this is a states' rights issue. States gain new authority to manage Medicaid, design innovative rural care models, and reduce red tape through more frequent, streamlined eligibility reviews. Rural investment. The dedicated Rural Hospital Innovation Fund aims to spur more modernized and prevent closures with smarter, locally tailored strategy. And market rebalancing. Phasing out temporary ACA subsidies is seen as a return to a more sustainable, competitive insurance marketing. The quote from the supporters: "This is about protecting the system for future generations by encouraging participation and eliminating efficiency." Okay, so I read two different sides of a coin, and there are two different groups of people. One of you were spitting and cussing and flipping me off at the radio or wherever you're listening with the first set. And that the second set of people did the exact same thing when I read the positives. Okay. So I'm just telling you, I already know that we are a divided country. I already know that we have different thought processes on this. And I also don't care. So that's where I'm going with that, so that I can give you solutions. That it doesn't matter, because you're going to have to deal with anything that comes at you, no matter who's in office. So let's get you strategies that are going to keep you profitable, keep your patients covered and taken care of, and keep that impact that you're making on your local community. Let's keep that going. Are you ready?
Yeah. So the mindset is, if you're upset on either side, that's fine. But the reality of it is, it's been voted in. It's happening. It's happening. At least for the next 4 years, until someone else tries to knock it out. Because that's welcome to politics. Like, if somebody brings something in, the next person that comes in, if it's a different type person, they're going to try to knock out that. I mean, it's always a back and forth game.
But let's rewind to 2010 for just 2 seconds.
Yeah.
Obamacare gets signed into law, the Affordable Health Care Act. Yep. And no matter where you fell politically, you still had to deal with the situation. Yeah. That's what I'm getting at.
So this is where we're positioning this podcast episode. It's like, it's happening. Yay or nay, it's happening. And we're here to talk to you about, how do you stay ahead of it? Because on the surface, it seems like it may be painful for an urgent care. ultimately.
I'm just going to go ahead and throw out there. I think it's going to be if you don't do some of the things that we're going to talk about.
Yeah.
Today.
So there's going to be some pain for an urgent care. And so today we're saying, let's go ahead and get ahead of as much as you can. And even if the bill turns out to not do the damage that you thought or vice versa, you're probably better off anyway because you're thinking ahead. Because I think that one of the biggest challenges that we find in the urgent care space, it's an insurance-based industry, and there's always challenges with somebody else is paying the bill. There's always challenges with that. But here we go. Let's go.
Are you ready? Are you ready?
Yeah.
I've said that like 5 times because this is listen, this is outside of I think Michael and I's comfort zone. Like we really don't like to bring any of this, but sometimes you just got to deal with things.
Well, and now that like you said, you've had multiple urgent cares bring it up to you.
Absolutely.
And so we're to the point where we ought to talk about it.
Yeah.
And we want your feedback too. We want to know what your thoughts are. Because at the end of the day, what we gave was just a non-biased thought process.
Correct.
We gave both sides. We're not voting for either side. We're just giving the sides. What we are voting for is how to be ahead of the game.
Well, and no matter what happens, we want people to get taken care of in their health care.
Yeah.
So, and you provide that. Here we go. Here's how OB-BBA may affect urgent care centers. Here's the expectation on the effects that you're going to see over the next 10 years. I think over the next 2 to 3 years.
Yeah.
So you're going to get a reduced Medicaid volumes because if in fact the claim is that millions may lose Medicaid, or they're going to face those barriers to access, it's going to lead to fewer covered visits.
You know,
right?
I do wonder, I want to ask this to our crowd, what percentage of your patients are Medicaid based?
Well, we're going to talk about that.
Yeah.
Yeah, we're going to talk about that. So that's thing number one. Thing number two is you're going to get increased uncompensated care, right?
Yeah.
So more people that are not going to have insurance benefits are going to be coming to see you because they need it. And if you're not equipped, they're all going to go to the emergency room because the emergency room is not allowed to turn them away.
Yeah, emergency
So you
room always treat.
better get ahead of it now. Otherwise, you're going to lose your business to free emergency room. That's going to train wreck another system. Number three, pressure on rural clinics. We don't deal with a whole lot of rural clinics, but we know you listen because you call us and we have conversations. So rural urgent care centers face financial risk if nearby hospitals close.
Yep.
Right? Because that free ER is no longer available to them. Or if they lose Medicaid funding. And then 4, patient confusion and drop off. Eligibility changes and cost sharing may cause patients to delay care or skip it entirely. Before I start talking about how we can fix these things, or at least like let's pop some vitamins and get you healthy into this situation rather than recover on the other side with surgery.
Yeah.
Right. So any thoughts on that so far, Michael? The challenges: reduced Medicaid volume, increased uncompensated care, pressure on rural clinics, and patient confusion and drop off.
So yeah, at the end of the day, if the eligibility requirements increase and the funding decreases, your expected volume of patients will change.
Correct.
And then because an urgent care is there to supplement an ER ultimately, right? Like to help relieve the ER, but now the urgent care can't see an X amount of people because they no longer can be funded for it. The ER is going to potentially suffer,
Right.
which then may cause a domino effect. And we're looking at it from that standpoint strictly because if we're going to prepare for something, we're preparing for that mindset. Because you don't want to prepare for it, it's going to be great.
Yeah,
Because nothing, gosh, if we thought that way about business in general, we'd all be bankrupt.
No doubt about it. No doubt about it. All right. Well, let's talk about some solutions then. All right. So we want to give you steps that you as an urgent care can take now to set yourself up for future volume drops.
Yep.
And you can maintain your volume. And it's funny that, again, I went and did my research, but I was saying this before I even knew what they were talking about, because they were talking at like our clinics were saying, hey, we're going to see this patient volume drop off. And I'm like, this brings me to the first thing: enhance your cash pay options. One of the conversations I even had today on a call, because he was so concerned about this, is I said, we need to put a pricing menu on your website so that for the people that don't have an option but to pay you cash, at least they know what they're paying for. You and I, Michael, have preached from the hilltops. They ask you answer framework.
Yep.
Right. They ask you answer. And
who you have to meet in person.
I did. I get to meet Marcus Sheridan in person. What a great dude.
Oh, he is amazing.
Yeah, he's a stud. There's no doubt about it. But nonetheless, the they ask you answer method is just simply if people are going to the internet and saying, I no longer have insurance, I no longer have Medicaid, whatever, how much does it cost for me to get this sprained ankle seen or whatever? And you answer it on your website,
yeah,
they're going to come to you
yeah.
and they're going to pay you cash and you're going to keep that customer. Sunburn, sprains, like you pick the top, you know what the top 15, 20 services are that everybody calls you about.
Yep.
Put a pricing menu together, put it live on your website,
and then
ASAP.
Put it in front of your front desk person. We recently had a front desk where they were making up pricing on the fly,
right,
for I think physicals,
right,
and they said, "Oh, it's $200." And then the next call, oh, it's $100. Next call, $150. Like, well, what is it?
Yeah, they were just making crap up.
They were just making stuff up. Oh,
Yep.
if it's Saturday, it's $250.
You want to know why they were making crap up?
They didn't know.
They don't have a clue.
No.
Give your team a pricing menu.
Yeah, it
If
was.
somebody says, hey, I need to come in there. I don't even want to use my insurance, right? For whatever reason. I don't even want to use my insurance. How much is it going to cost for me to come in here and get this sore throat checked out? Well, it's going to be $150. Sweet. When can I come in?
Yeah. And I think that's the part too. Like, don't be afraid of your price.
No.
I think some people are probably have a fear of, if I give a cash price, they're not going to come. Like, no, that's not how that works. My goodness, we're so trained now. Like I was telling you, like I went to a restaurant yesterday with 3 of us and it was almost $60. Well, that means I could have gone to 2 restaurants yesterday and got and then the price of going to a non-insurance claim doctor visit.
Right.
It's just insane. But no, like, don't be afraid of your price. You talked about vitamin C, so vitamin cash, right? Vitamin cash of getting stuff indoor, and be prepared for that and train your people on it. And you're going to, honestly, like we said, you start doing this now, you're going to start benefiting from it now. Of they're at this very moment, there are uninsured people that want to pay cash for their services.
Right.
And if you don't have a clear way of answering that question, they're not going to call on you. Because there's clinics we've talked to that are cash only, and they kill it.
Yeah.
And they tell you they kill it. And the best part with cash only is you're not relying on a third-party vendor that may or may not like you.
Well, I'll take it one step further. I would go ahead and start thinking through a concierge model.
Membership models.
As an option for your urgent care for people who don't have insurance, you can insure them. And what I mean by that is just simply say, here's our cash options, or you can have X amount. It's this much a month, $150 to $300, something like that for your whole family.
Yeah. And
we'll see you anytime you want to come. You get priority, and also you get a discount on all of our menu options of 20%. Now, think about this.
Mm-hmm.
Every HVAC company in the nation right now is offering this.
Yeah.
They are.
The Comfort Club.
Well, here's the thing. Yeah, the Comfort Club, right? What they'll do is they'll come out in the fall and they'll come out in the spring and they'll check your units to make sure that you're ready to go. Well, that sounds a lot like a physical, doesn't it?
Yeah.
Right? That's covered just as being a member. And then you get 10% off of any service, and you get 20% off any install of a new unit if you ever have to have those things, right? Well, there's not an insurance coverage for HVAC units out there, right? Maybe American Home Shield, but you got to fight them tooth and nail.
And they're not going to
That sounds a lot like insurance. Do you see what I'm saying?
Yeah.
So people are buying these HVAC unit concierge plans like crazy. That's the number one driver of value for them because it's a retainer-based model. It gives them 2 very clear-cut visits, which I'm not saying model it after an HVAC unit. I'm just giving you an idea here is have a concierge model that people can buy into who don't have insurance so that they can self-insure through you. And guess what? It's super freaking sticky.
Yeah. Well, and so that model in the urgent care space, I've heard it called like direct care model. So you have direct care. Yeah. And then you have concierge, which is like the higher end version, which I don't, that may not be urgent care focused because you can't have a lot of volume with pure concierge. It's supposed to be like high touch. But we actually have some urgent cares that run off of these monthly memberships. And the best part, to me, it is just like a car wash where the car wash you pay $20 for nowadays.
Try 40.
Or the numbers are getting high.
Right.
They used to be $8 or $5 car washes. Now they're 20 plus. One time $20 car wash, and they always say, or if you do more than one car wash a month, you save money with the membership.
Right.
And what does that actually do? When it rains, they make money. When it doesn't rain, they make money. When they have their machine down for a day, they make money. And they're not living on that daily car wash volume, right? Daily car volume. Same idea for an urgent care is, you don't need, and that's the thing. I bet if you did a split on car washes, it's probably like 30% membership and whatever. But that 30% is the difference between having a really crappy month and having a really good month.
Right.
Same concept for you guys. If you are pushing 25 patients per day, and so you're doing, maybe 1,000 plus patients a month, what if 20% of your patients were membership-based patients, which means they don't have to show up, but they paid. And all of a sudden, like, it doesn't have to be your whole mix. Like, all of a sudden you have an additional income that's predictable, because predictable income is so much nicer than hopes and prayers.
It's awesome. But Michael, people won't prioritize their health care if they have to pay it out of pocket. They're paying it out of pocket anyway with every single paycheck that comes out of their company.
I'm about to say, so I think
that's a lie that you are internalizing. They will prioritize their health care. We have excellent health care. My wife talks to me regularly about how we should get concierge.
Yeah.
She does. Yeah. She's like, I don't even want to deal with it. I'd just rather have concierge. I was like, but we have insurance. She's like, just pay extra. Yeah. Right.
Well, and it's true because, like nowadays, like we're in Blue Cross land here in Alabama, but a single individual is paying $400 to $600 minimum a month for insurance they don't use. And then all of a sudden they paid $5,000 a year for insurance they haven't used. Mm-hmm. And then that $150 twice a year, or $50 a month, or $1,200 a year versus $5,000.
You're saving them a fortune. You're doing them a service, and you're keeping your money instead of the insurance companies keeping your money.
Yeah, because you get to directly bill them on a credit card that's recurring.
Build them points up.
Yeah, so it works.
What do you mean the OB-BBA was a terrible? I'm just kidding. I'm just kidding.
But the best part is, if this bill didn't exist, this concept has existed for a long time.
This works either way.
Well, I think people forget too that health insurance was not a thing.
Right.
Not that long ago.
Right.
But now we're trained by it. So
That's
like
right.
we have to abide by the rules, and here we are.
Well, next thing, double down on your digital marketing.
Yeah.
But I'm also serious.
Volume matters.
Digital marketing doesn't just mean running ads or getting found on Google. You can use text message marketing, and you can use email of a group of patients and clients that you've already generated, and you can educate your patients on this new insurance rule. One, educate them from your perspective and how it's going to affect them. Put your politics in there. I don't care, right? You get to say what you want to the people that have come to you in the first place. I would argue don't alienate people.
Yeah.
But I'm just saying, like, if you think this is going to have a profound impact, educate them on how it's going to affect your ability to give them care, and then show them a path to do business with you anyway.
Yeah, I mean, because I think that's key, right? That if you're communicating a problem, you must have a solution ready to go.
Yes.
Because if you're just communicating a problem, it's just all negative.
That's called whining.
Yeah, right. You're just belly aching. And so, but if you put behind it, like, hey, this is happening for those who are, I mean, because like I actually know who's on Medicaid, who's not, because I have first party data.
Right.
And it's like, hey, if you feel like you're going to be losing this coverage, we have now a new plan just designed for you to keep you healthy.
That's right.
And for only $99, whatever the number is, click here to sign up.
Right.
And now you're educating. And now, gosh, there's a whole campaign of, did you lose your Medicaid coverage? Click here and we'll take care of it. There's a whole thing.
That's a whole campaign you can do there. And listen, we're not, this sounds like it's self-serving and that we're just trying to make more money for you. Honestly speaking, we're trying to help people get care that they need in a situation that they may be losing their care. And yeah. I hope you feel that. I hope that's coming through. The way we can do that is to help you grow your clinic.
And we know, because we've talked to a lot of our audience now, you guys are quality providers.
Correct.
Like if you're listening to this podcast, you actually care.
That's
we
right.
know that. So.
That's right. All right. Target the underinsured. These are the people that are going to have, like us, really high deductibles.
Yeah.
Right. And target them. Promote the services to those that are shifting from Medicaid, because they'll be shifting from Medicaid to the most affordable access that they can get, which means the cheapest they can get, which means the highest deductible they can get.
Usually, yeah.
Yeah, that's what that means. I mean, there's not really any in between.
It's just like any insurance. You can pay more with low risk, pay less with high risk.
That's right.
And that's it.
That's right. So you're going to target them. Well, how am I going to target them? Ads. Like I don't know how to say it other than to say, like, if you write an ad that says losing Medicaid and switching to insurance, we got a plan for that, right? That's an ad. You can do that through Facebook, Instagram, TikTok, I don't know, television, print, radio. If you are truly serving your community, send a postcard to everybody within reach of your community and let them know, hey, we know this is coming. If your plan is to do this, you need to come see us, or at least scan this QR code where we can tell you all about how we can help you get the coverage that you need or the care that you need by coming to our clinic. We have these options available to you.
Yep.
Right. And then market your urgent care as a lower cost option to ER, because what's going to happen is people are going to go to ER. Let me just tell you how this is going to unfold. People are going to lose their insurance if that's going to happen, right? If that happens, they lose their insurance. They start going to the ER. What they don't understand is that it takes a lot. The ER has to see you, but that doesn't mean that they don't have to bill you. And now you're dealing with collections. You're dealing with bankruptcy. You're dealing with all these things. And I know I'm showing a very dark side of this.
Or extreme wait times.
All the different things that are going on there. I would rather, of course, I'm obviously not in a position where I'm about to lose my insurance right now, but I'm just thinking, like, I would rather pay something than have to deal with the back end hassle of trying to talk to collections and everything else. Let me tell you, it feels like another lifetime ago, but there was a time where we defaulted on something and I got served papers and summoned to court to pay a bill that I couldn't afford to pay. Again, I was in my 20s at the time, but I wish I had paid up front to not have to deal with the embarrassment and the hassle on the back end of something that at that time, I think I probably could have controlled it. I just was negligent or something. I don't know. That's not the point. I think the point I'm trying to make is if you offer yourself as an alternative to that scenario, people are going to choose you.
Yeah.
Okay?
Yeah. I mean, yeah. Because I think the ER side thinks, the ER is there to serve, right?
That's right.
And then I remind people, like, they're going to treat you. Now, if you are openly like this person has no coverage whatsoever, they're going to treat you at a minimal level.
Right.
And then the aftercare doesn't exist because they know they can't collect on you. So why should they provide aftercare?
That's right.
And so it's real. So it's going to be real interesting because, as it stands right now, the ER system is still overwhelmed. I think the urgent care system has helped alleviate a lot of it, but it's still happening. I'm actually kind of hoping maybe this will force to be talked about, or the UCA talks about there's, right now there's no actual code for urgent care yet, and they're trying to push for a code for urgent care, which makes total sense. Like, why wouldn't you at this point?
Right.
Maybe this will accelerate that, which would be awesome, because then there's more impact on that. But no, I mean, it's a real thing. Like, at the end of the day, if you take away coverage and then your only option is the free option, and then the man will go up, and that means longer lines and worser care tend to happen.
Worser care. Mo bad. Oh, that's good.
Worser. Sounds like Worcestershire.
Worcestershire?
However you say that stupid word.
Yeah, who knows? All right. Last bullet point, and then we'll wrap up and let you get on with your day. I think it's worth following the money trails of where people are still going to be able to pay you.
Yeah.
And it may be time to start looking into Ahmed. And the reason I say that is employers are also going to be impacted, right? Yeah. Their rates are going to go up. So having an option of a cash pay option or a flat rate, they can send as many employees to you as they want a month, whatever it is.
Yeah, because I don't need an employee to go to the ER for a cold.
Yeah. So if we could, if we could create at our clinics a solution that's going to better serve the business community, that again is, I don't want to say guaranteed, but a higher likelihood of getting a stream of patients that you don't have to go to Google and pay for the ads for. You have businesses that are sending that to you. I mean, even if it's 20, 30 of their employees a month, like look for those opportunities in Ahmed and find some creative ways to serve businesses. Again, we're just trying to prep you. If in fact the negative side of this comes down and you start having people drop off of Medicaid, Medicare, ADA, all of those different kinds of things, you could be the go-to solution to really make a positive impact in a dark situation.
Yeah, I still, I've mentioned this a long time ago, but I'm still waiting. I want urgent care. If this urgent care is listening, I want you to contact me because I want to see it in person. For the Ahmed side, I want to see that mobile urgent care roll up in front of a manufacturer facility and just park it 3 days a week and take care of people coming in and out. That simple. I don't know why no one's like, I only know about it because I had an optometrist that I was a patient for, and he spent 2 days a week in front of Honda and would process like 200 employees at a time for glasses.
Yeah.
And of course, Honda would pay happily for that. And so I'm curious, where's the mobile urgent care? I know mobile urgent cares exist because we've talked to a couple in the past, but I've never talked to one that parked it in front of a business and just took care of the business or the school. Like, I still want to see this happen. I want to see us. I know we told one of the bigger urgent cares, hey, get you a sports physical van type thing, park it in front of the school and say, get all your physicals today.
I love that.
Like, just, you got to be creative, right? You have the resources. You just got to be more creative with what you're currently doing at the end of the day. Like, just be creative, because what you were doing, if you were doing the exact same thing today that you were doing 20 years ago, of course you're going to get left behind.
Right.
Because things change. And what we're doing today in our agency is, if we were doing the same thing 5 years ago, we would not be an agency anymore.
That's it. You're right.
So
that's right. Well, hey, I hope we've given you value today. If you loved this podcast, share it with your other clinic buddies. If you hated this podcast, share it twice with your clinic buddies.
Also, we love when we hear, we recently got one where they said they share it with their leadership.
I love it.
I'm like, oh, yeah, this is awesome.
That's right. And I'll just do a special shout out to those clinics who are in the infancy of getting their clinic started. We know how hard it is. We got you if you need us. Just reach out to us. We want to be a good resource for you as well. So y'all go out and crush it, and try not to get too wrapped up in the politics, and figure out how you can care for your patients.
There you go.
All right.